My name is Ada Skiles, and I'm the Associate Director of Chapin Hall at the University of Chicago, which co-sponsors the Thursday's Child series along with the Urban Institute. Chapin Hall and the Urban Institute launched Thursday's Child nearly 3 years ago as a monthly forum to engage people from a variety of professional roles in an extended conversation about policies and programs affecting America's children and youth, their families and communities. Today's program, The Real Costs of Teen Motherhood, will be moderated by Chapin Hall's Executive Director, Matt Stagner. Matt is also a senior lecturer at the University of Chicago's Irving B. Harris School of Public Policy Studies and is an expert on youth risk behaviors, child welfare services, and program evaluation. Before returning to Chapin Hall, Matt directed the Center on Labor, Human Services, and Population at the Urban Institute and was division director at the U.S. Department of Health and Human Services, Division of Children and Youth Policy. Matt currently chairs the Research Advisory Panel of the National Campaign to Prevent Teen and Unplanned Pregnancy. I'll now turn the program over to Matt Stagner, who will introduce our panel.
Okay, thank you. Thanks, Ada, and welcome to everyone both here at the Gleacher Center as well as listening in on the audio cast. It's a great pleasure for me to moderate this panel for several reasons. One is the importance of the topic that we'll be talking about today, and also the fact that it's a panel of people I've had the pleasure to work with over the years, either at Chapin Hall or with the National Campaign to Prevent Teen and Unplanned Pregnancy. So let me briefly introduce our panel. Then each of them will have a few minutes to make a statement. And at the conclusion of that, we'll have 20 minutes or so for audience questions and some back and forth. Our first speaker will be Saul Hoffman. He's professor and chair of the economics department at the University of Delaware. He studies economic forces and demographic behavior, looking at not only teen pregnancy, but also divorce, non-marital relationships, and the welfare system's effects on family structure. Importantly, Saul is a co-editor of a new book called Kids Having Kids, which is available now from the Urban Institute. You have a packet, in your packet, a flyer telling you about it, and Saul and our second speaker will be telling you about the findings from that book. Our second speaker is Bob Gurga. Bob is a research fellow at Chapin Hall. He studies many children issues, including maltreatment, disability, poverty, mental illness. He's developed Chapin Hall's integrated database of family services in Illinois, and he is a co-author of a chapter from Kids Having Kids. Then we're going to go to the practitioner perspective, and we have a former Chapin Hall staffer, Pat Messina, who now is the president of Options for Youth. She directs programs including the Illinois Subsequent Pregnancy Project and Options, and also the Peer Advocates for Health program for African American young men on the south side of Chicago. Several years ago, Pat worked at Chapin Hall, and some of the ideas for her programs came out of her work at Chapin Hall in the 1980s. Finally, it's a great pleasure to have in Chicago Sarah Brown, who's the CEO of the National Campaign to Prevent Teen and Unplanned Pregnancy. Before that, she was a senior director at the Institute of Medicine in Washington and worked on maternal, child, and reproductive health issues. She then co-founded the National Campaign. It's my pleasure to chair their research advisory panel. And Sarah speaks frequently, as you might imagine, on issues of teen sex and unplanned pregnancy. So each of our speakers, again, will talk for a few minutes, and then we'll open things up to questions. First, I'll go to Saul.
Okay. Thank you, Matt. It's a pleasure to be here this morning and visiting Chicago. My job is to kind of give you an overview of the research findings and how it should have, and how you might want to think about it. I think it's a very interesting and appropriate time to be talking about teen pregnancy, and really for three reasons. First, of course, there's the publication of the new and improved second edition of Kids Having Kids. And the first edition was a wonderful book. It was an award-winning book. It was the first really concerted effort to bring a lot of scholars together to think about teen pregnancy from a research perspective. Because it's a very hard issue to think about what's the independent contributing effect of a teen birth to outcomes. It's a very complicated research problem, and that was a beautifully done job. The second, better yet. Second, of course, I don't have to tell you, we've had 2 very highly publicized teen pregnancies this summer, so we're in the national spotlight. Personally, I think both of those were kind of squandered opportunities to have a serious conversation, and maybe this session and this book can kind of contribute to having a more serious conversation about teen pregnancy. And third, and maybe most important, 2006, we had an increase in the teen birth rate for the first time after 14 consecutive years of declines. Now, we've seen that pattern once before. The teen birth rate fell every year almost from 1960 to 1985, almost 25 years in a row. And then it rose 6 years in a row, and it wiped out 20 years of progress. Right? So we've seen that 20 years of progress wiped out. So this uptick in 2006 is a matter of serious concern. We should certainly be thinking about what's going to happen when the 2007 numbers come out. And if I get a chance, I can show you that there's a little bit of evidence of what we may see there. Okay. Now, Kids Having Kids is a very long book. I have the moderator at my shoulder here, so I'm not going to be able to go on too long. Let me try to give you a big picture view of what I think the core ideas are and how to think about it. I'd say there are 3 takeaway points. And the first is that teen births do have substantial, widespread negative effects, and especially so for the children of teen mothers. Now, when I say that, that means more than sort of the obvious observation that teen mothers and their families are not doing very well on average. It actually means that a teen birth makes a situation worse than it otherwise would be. And in saying that, I'm trying to say it has a causal effect rather than simply being correlated with other bad outcomes. Okay. The children, it appears, are the prime source of bad effects. And what we know, I'm just going to very briefly summarize, they're more likely to be involved in foster care or incidents of abuse or neglect. They're less likely to graduate from high school. The daughters of teen mothers are more likely to have teen births themselves. The sons are more likely to be incarcerated at some point. And all these are are really trying to identify the causal piece of it. The evidence on the effects for the mothers are a little bit more mixed. In the first edition of Kids Having Kids, there was this provocative finding that the mothers seem to be no worse off by having a teen birth, and maybe even better. With another 10 years of research and I've been part of this, my own sense now is that that's much less true, possibly not true for more current cohorts of teen mothers. I'm not going to be able to focus on that piece now, but I'm happy to talk about that a little later. Second, teen births are costly to the public sector. And in Kids Having Kids, we measure that through 2 things. The increased public sector services that teen mothers and their families consume, and then the lower taxes that teen mothers, their spouses, their kids, and so on pay by virtue of lower earnings. And if you add all that up, in a world like 2004, not literally 2004, but in a world that has all the characteristics of 2004, it adds up to about $7.5 billion annually. And that's an important number because those costs that could be avoided are the benefits of an effective program that could delay teen births. Third, a teen birth is not the only cause of the poor outcomes for the children and the mothers. Other things matter, and sometimes they matter a great deal. But don't confuse that with the idea that teen mothers and their families are doing pretty well on average, because that's not true. Now, when I say teen births have negative effects and large costs, a lot of you might say, duh, tell me something I don't know. Okay, fair enough. Here's something you don't know, and I could go to any chapter, but I'm going to pick the one on incarceration, because it's the details that reveal the story. So here's some details. The sons of teen mothers are more than twice as likely to spend time in prisons as sons of mothers who have a first birth in their early 20s. If you take account of the major differences between women who have a later birth and women who have an early birth, the difference isn't as big as 2 to 1, but it's still 30%. Even if you compare sons of the same mother, one a son of a teen mother and one the son of the mother when she's a little bit older, the one who's the son of the teen mother has a 15% higher chance of being in prison at some point. And that's about as tight a comparison as you can ever get. The total bill for that, once you think about what are the costs of incarceration, ranges from somewhere between $2 billion to $4.5 billion annually, depending on which of those estimates you want to think about. And that's actually an understatement because it doesn't even pick up juvenile justice costs. Now, I'm in Illinois here, so let me just tell you another thing you probably don't know. We estimated the cost of a teen birth separately for each state. So in Illinois, we can say teen birth annually costs the taxpayers of Illinois about $260 million each year. And about a third of that is for incarceration. Now, I want to close with one more point. Kids having kids is a model of how to think about this kind of analysis. When I say that the cost of a teen birth are about $7.6 billion a year, you should believe it. I could have pumped those numbers up and made them twice, 3 times as big. But we really proceeded conservatively in every case in 2 ways, and I want you to understand that. First, it's always when you think about this, it's always compared to what? And in this case, it's not compared to some idealized standard. It's not like, we're not trying to pretend that young women who have a teen birth should wait till they're in their mid-20s, married and middle class, and then have a birth. The idea is to compare it to young women who have a birth at age 20. And implicit in that is that we can somehow intervene to delay first births to age 20. Now, I don't say that's easy, but it's not ridiculous and it is achievable. Second, all the analyses really do take account of all the other risk factors. We're not over-attributing. We're really trying to say this is the piece of it that we could avoid if we simply could convince young women to delay a first birth and really didn't change all the other things in their lives. If we could change all the other things in their lives, better schools and neighborhoods and all those things, we'd have an even bigger impact. So as a result, we can take those numbers seriously. We can point to them. We can say if we can intervene and delay a first birth, these are the real benefits that can be achieved. So that means it's worth spending money. Okay. Now, I noted earlier that the biggest costs are those associated mostly with the next generation, that is with the children of the teen mothers. And one of the largest costs, and certainly one of the most wrenching, are those costs that are associated with foster care and the child welfare system. And we actually estimate that costs about $2 billion a year in terms of increased use of those services. Bob Gerga is our next speaker. He is the national expert on that relationship. He wrote the chapter on kids having kids on that, and I'm very pleased to turn the microphone over to him.
Thanks. I first want to acknowledge Alan Hardin's contribution to the chapter. He's sitting right over there. In 2006, 3.3 million children were reported to state child welfare agencies as abused and neglected. 905,000 of these reports were confirmed with clear evidence of maltreatment under state law. Infants and toddlers had the highest rate of victimizations. In 2006, over 500,000 children were in foster care in the United States. So it's a big problem nationally, and we know that it's a large problem in Illinois also. Several studies show that adolescent mothers are more likely than older mothers to be stressed by parenting. Really, when the issue we're talking about here is really how good of a parent are you, or how poor of a parent are you. However, what we measured really was coming to the attention of the Child Welfare Agency. Somebody has to report a family for abusing or neglecting their children. So we miss a lot of, I believe we miss a lot of abuse and neglect. And in very few cases, kids with minor abuse or neglect may go into foster care. But the kids we do get into foster care are clearly abused and neglected. But it also has to do with the visibility of these families. There is an issue of overrepresentation of African American families in the child welfare system. There's been a lot of work done on that issue, and we continue to do some of that work. So I just want to make it clear that we're not looking at pure abuse and neglect above anything else. We're looking at who's coming to the attention of the state. And then when Saul speaks of the effects of this, we're talking about the effects, the costs to the child welfare agencies. Adolescent parenthood is also an issue that has been not well recognized in the child welfare field. This is reflected in the largest study being done currently over the past 10 years, the National Study of Child Abuse, Child and Adolescent Well-Being, funded by the federal government. We don't even collect information about the biological parents of children in the foster care system. We don't even know the age of children, age of the parent in the child welfare system. So it's a big missing piece. And for that reason is why we did the work in Illinois. We happen to have excellent data in Illinois, and the piece of information we really need is the birth date of the mother, and that we don't have in many states, most states in the country. Across the entire period of our study, 1982 to 1998, the incidence rate for children under 5 years old in Illinois was 53.4 per 1,000 births. This is for children of all ages. For children of mothers who had their first birth before the age 18, it was 111 per 1,000. And that number is nearly 3 times the rate of mothers older than the age of 20. Relative to foster care, between 1982 and 1998, for every 1,000 births in Illinois, 20 of the children entered foster care before the age of 5. The rate is nearly twice as high for children of mothers under the age of 18, and 50% higher for children of mothers under the age of 22, compared to mothers age 22 or older. Now there's a handout in your packets, looks like this. I want to focus on this handout just for a couple minutes because it shows that how these families, the children of these mothers, account for most of what's happening in the Child Welfare Agency in Illinois. If you look at the first table, these are foster care entries between 1982 and 2003, over 100,000 first placements. The children for whose mother had their first birth under the age of 20 account for 61% of the foster care entries during this period of time, which is obviously almost 2/3. So it's a large portion of what happens in the Child Welfare Agency in Illinois. Table below shows the fact that these kids spend more time in foster care when they do go into foster care. For children whose mother was 15 or under at their first birth, they spend an average of over 1,000 days, and as the mother's age of first birth gets greater, the numbers fall, so that you can see 22 and older, it's only 638 days. So not only do children of mothers who had their first birth as a teen account for more kids entering, but they also account for more of the days that are spent in foster care. These maternal age-specific incidence rates and duration measures that I just talked about don't necessarily reflect the independent effect of maternal age. So we also did some multivariate work controlling for some of these. You might say other things might explain what we see in the charts below. Well, when we do that multivariate work, we still find that there's a significant effect of the age of the mother, both in terms of being reported for abuse and neglect, as well as entry into foster care. So just as a transition to the next two speakers, one of the things we thought about was what would happen if you did delay the birth until 20? What would happen with the mother? Would she become a better parent? Would she be able to finish high school, work, or go to post-secondary education for a period of time? Would that help her then become a better parent, or at least be able to muster the resources to either protect her child more or to not have the conditions under which neglect might be present. So that's really kind of the nub of the challenge around the intervention. What would happen if we could delay that? How would the parenting skills that mother had change if we could just delay that a few years?
Great. What we try to do in Thursday's Child is first start with the research. What are the recent findings? And then turn to both a practitioner and a policy level discussion of what does this research mean? What can we do about this problem? So we've now turned first to Pat Messina, who has now years of experience trying to deal with this issue that Saul and Bob have shown the costs of. So Pat.
Thanks. Thank you. Thanks to the work of Saul and Bob and the national campaign, the cost of becoming a teen parent are increasingly being recognized. But what's less well known is that 1 in 5 babies born to teen mothers in this country each year are not first births. That is, 1 in 5 babies born to teenage mothers are second or higher order births. And if current trends continue, 1/4 of the young parents, of the teen parent mothers in this U.S. will have a second baby by the time they're age 20. Many young mothers can make it with 1 child, but the cost of a rapid second birth while you're still a teenager is much greater in terms of lost educational and employment opportunities and on the impacts to the health, developmental, and behavioral impacts to their children. Rather than talking about these consequences of repeat childbearing today, what I'd like to do is to describe for you a program designed to delay second births among teenage mothers that is being implemented in communities across the state of Illinois. The Illinois Subsequent Pregnancy Program, or SPP for short, is one of the few adolescent programs in the country that focuses specifically upon delaying a second pregnancy among adolescent mothers. This program, SPP, grew directly out of empirical research that was done in the mid-1980s at Chapin Hall. A longitudinal study of teenage AFDC mothers found that 1/2 of these young moms would have a second baby in 3 years. And this greatly increased the chances of school dropout and longer-term welfare dependency. At that time, we went to the state of Illinois with these findings and said programmatically, couldn't we do something to lengthen this second interval? The state essentially said, yes, do it, and has provided continuous support since 1990 for the development and the refinement of the subsequent pregnancy program model. The program actually began as a small pilot project in Chicago in 1990. In 1994, based on our outcomes, it was expanded to communities around the state. And since that time has been carried out as a collaborative effort between 7 community-based organizations, 4 health departments, and 3 social service agencies. Because of the continued support from the state of Illinois, we've been willing and able to work with the home visitors from each of these 7 agencies over time and have developed a model effective in helping young mothers delay that second child and complete their high school education. Of the 3,000 young moms who have participated in SPP from over 30 communities, only 3% had a second pregnancy while they were in the program, and 85% have stayed in school or graduated. Now, the subsequent pregnancy program model has 2 primary interventions: individual support, which is provided by an ongoing personal relationship with the subsequent pregnancy home visitor, and substantive training through membership in an advisory group. The subsequent pregnancy home visitor provides ongoing individual support to the 25 young mothers on her caseload. She steps in and becomes surrogate mother, sister, welfare advocate, school advocate, whatever it takes to support this young mom and her baby. Training is provided in advisory group meetings which meet weekly or bi-weekly depending on program site, and the same subsequent pregnancy curriculum is presented across all sites. After a young mom has been in the program for a year and has attended the required number of meetings, she's trained as a subsequent pregnancy peer educator and paid an hourly stipend to go out and work in her community or her schools during the second year of program participation. Now, these peer educators become very effective communicators when they talk about how hard it is to be a teen mother. And they reach over 1,000 other adolescents each year with their delay message. Approximately 300 first-time adolescent mothers participate in SPP each year. 2/3 of those are African American, 1/4 is Mexican, with a smaller proportion of Caucasian and Puerto Rican participants. Their mean age is 15.9 years, and the average age of the babies is 11 months. Half of the young mothers are pregnant, or half of the participants are pregnant when they join subsequent pregnancy, and half are parenting one child. A majority are in school, and almost all are unmarried. At the end of each program year, we look at 3 participant outcomes that actually reflect the primary goals of this program. That is to delay a second birth, practice contraception correctly and consistency, and remain in and graduate from high school. As shown in your handout, which is in your packet, these outcomes have been amazingly consistent across time and across diverse populations of adolescents. Between 1996 and 2007, the proportion of participants who had a second birth while in the program decreased from 4% to 2%. The proportion who reported using an effective method of contraception at the end of the year increased from 77% to 95%. And the proportion who stayed in school or graduated increased from 76% to 93% in 2007. Many of these young mothers are now in college, and at least 2 have master's degrees. After many years of subsequent pregnancy program experience, we can suggest at least 3 strategies that we feel contribute to the effectiveness of this program effort. The first of those is the focus on delay. While many adolescent programs have preventing repeat pregnancies as their goal, this is the primary goal of subsequent pregnancy. We had to learn how to maintain this focus, but then one of our peer educators stood up in front of the group and said, "If you ain't serious about not getting pregnant, don't waste your time and don't waste our time." And that's been the mantra since then. The second strategy is a very conscious and effective focus on contraception. Each of these young moms has had sex at least once. They are given comprehensive contraceptive information in group, and the home visitor follows up continuously throughout the program year with clinic appointment times, depot shot dates, new boyfriends, perceived side effects. There is a continuous follow-up. And finally, and most importantly, is the role of the subsequent pregnancy home visitor and her personal long-term relationship with each young mother. Our programming experiences has shown us unmistakably that information alone is not enough. If we're really going to have an impact on the behavior or the lives of these teenage mothers, we have to provide both information and long-term individual support. Providing information is the easiest part, but then you have to help this young mother process this information in relation to the real-life situation, to her real-life situation. And this requires a personal relationship, an ongoing relationship, and immense time and effort on the part of each subsequent pregnancy home visitor. This doesn't happen in 2 weeks, and it doesn't happen in 6 weeks, but it's critical to delaying a subsequent pregnancy. Thank you.
Thanks, Pat. Our final speaker is Sarah Brown from the National Campaign to Prevent Teen and Unplanned Pregnancy. Sarah?
Matt, thank you, and thanks to all of you for letting me leave Washington. That's always a distinct pleasure. And I'm happy in particular to be here with Matt. He does so much for our organization, and it's lovely to be able to return the favor just a little bit. As you might imagine, I'm delighted with the focus of this symposium. This issue of teen pregnancy and motherhood is very intensely interesting right now, but you know, it hasn't always been so. There was a time in the 40s, 50s, and 60s when this issue wasn't even talked about much. There was an enormous amount of teen pregnancy. It was frequently resolved by early marriage, illegal abortion, and a large number of babies placed for adoption. I grew up in New York, and the young women in my school who became pregnant, I realized years later, always went to Chicago, incidentally, to visit Aunt someone. So I don't know if the aunt is here, but it was always Chicago. I just was thinking about that flying in. Anyway, one of the big changing events was when the Alan Guttmacher Institute released a report in 1976 called 11 Million Teens, which really began to talk very directly about teen pregnancy, teen sexual activity, and so forth, and I think we're still standing on the shoulders of that pioneering work. As important as this issue is, though, I must tell you, I sometimes think we almost overestimate its importance. In my job, I constantly meet people who say this is the most serious problem affecting the nation. President Clinton even said that in a State of the Union address in 1995. It is indeed very serious. As the previous panelists have mentioned, and this tough economy, I think, makes it even more serious. But it's not the only serious problem, and I think sometimes we need to remind ourselves to put it in perspective. But what I'd like to do is really talk about prevention, just sort of not getting pregnant in the first place, as distinct from sort of managing the consequences. And my simple idea is that investing in policies and prevention should be a legitimate and powerful claim on policymakers at both the state and federal level. I think it is a good idea to ask for money for programs and for research that support prevention. And in this context, I just want to note that the cost arguments that Saul laid out are very powerful, and I really commend Saul and Rebecca Maynard and others who developed this volume for their elegant analysis that are reflected in part in these cost numbers. You know, for policymakers, cost-based arguments really do work, especially if the cost can be tied to public sector costs. Now, I mean, many of us might wish that we could interest policymakers in these issues on the question of human suffering and capital, the human capital issues alone. But you know, if you're the average policymaker, every day you meet people who have important issues to bring to your attention, who have a legitimate claim on taxpayer dollars. And when our issues have dollars attached to them as well, it really does make a difference to policymakers, particularly if they suspect that there might be some savings, not just outlays, but if they invest, there will be some savings. It might actually lead to that crucial vote. But then the hard work begins. Once we have a policymaker's attention to the issue of teen pregnancy and childbearing, what really is it that we ask them to invest in? There are lots and lots of things to do. And I can tell you right now that the minute we start talking about preventing pregnancy or pregnancy planning, we are in a fraught area. This brings up the issues of the culture wars. This is why I love leaving Washington. You know, it's one thing to deal with something once it's in place, but it's another thing to talk about prevention, because it invariably causes us to have to talk about teen sexual activity, contraceptive use, role of parents, and on and on and on. So a lot of policymakers would actually like to leave the room at that point because they're a little worried that we're going to enter what I call sort of the ick factor or ick land. So the list of things that we often bring to policymakers are things like, obviously, Medicaid coverage of family planning, and the Title X program, which is the only publicly financed federal program devoted exclusively to contraceptive services, both for low-income women and adolescents. Those are sort of the two obvious things that many advocates bring up. You know, both of these remedies, the family planning remedy, focus on a very simple biological fact. The only teens who are getting pregnant are those who are having sex and are not using contraception very carefully. It's sort of back to Bio 101. And so it's not surprising that a family planning set of policies often comes to the fore. And in fact, there's been quite a bit of analysis as to why the teen pregnancy rate did go down over the last 15 years, about a 38% decline between 1990 and 2004. And in fact, more use of contraception was a powerful reason. It wasn't the only one, but it did contribute to the decline, especially in some communities, use of Depo-Provera. Since the later 1990s, another policy option I think you're all very familiar with is the hundreds of millions of dollars that has been invested in abstinence-only community education grants. The idea here is that wouldn't it be better if we could encourage young people not to have sex in the first place? And we can talk a bit more about that later. And in fact, it is also true that there was an element of less sex that also drove down the teen pregnancy rate over the last 15 years. It was probably more about improved contraceptive use, but there also was a decline in the proportion of high school enrolled teens who report having had sex. Then there are a number of other policy areas that often don't sort of say pregnancy planning and prevention, but in fact bear very heavily on these issues. They include a variety of youth development investments, mentoring, community service activities, some aspects of public investment in fatherhood programs, and even in marriage promotion programs. Although again, in each of these areas, pregnancy planning and prevention for teens or indeed for older individuals is often sort of a sidelight, and you have to read the fine print to make sure it's actually in there. Now, this sort of mishmash of approaches that policymakers are presented with when this topic is in front of them, I think reflects a few realities in this field that I just want to clip through very quickly. Mainly, I guess sort of overstate them, but it's mainly to tee up a lively discussion, Matt, which this issue always ends up in anyway. But I want to tell you, though, here in Chapin Hall, which I admire so much, that one of the bottom lines is that truly more research is needed. Our policy investments and our results would be better if we knew more about this area of teen pregnancy and childbearing. So number one, consistent with that view, is that, for all the work that's been done here, we really are not very clear about which 3 or 4 factors are really causal and behind these high levels of teen pregnancy. Please understand that despite all the progress we've made in this country, the U.S. still has the highest rates of teen pregnancy and birth in the entire developed world. And we just don't entirely understand how to parse out this complex picture. It's individual factors: family, parent, environment, biology, contraception, couple dynamics, values, faith, social norms, family planning technology and systems, and so forth. Secondly, believe it or not, we really don't know what drives these teen pregnancy rates up and down. As Saul mentioned, we had an increase in the teen birth rate reported about a year ago. I believe we're going to hear bad news again, just in time for the holidays, of a second-year increase. And when I'm asked, and many of you are asked, Ms. Brown, why are the rates going up? Or for that matter, a few years ago, why are the rates going down? We have imperfect answers at best. Number 3, we know a bit about programs that can help, and PATS is a wonderful example. And my own organization, as well as this new book, Kids Having Kids, number 2, does flag some approaches that have merit. But all of us who've taken a sort of cold-eyed stare at this area know that the magnitude of effects of some of these programs is probably modest, often short-lived, and that some of the ones that we really do think are the most effective may be very expensive, which also puts us in a tough situation when demands on public sector or even private sector dollars are so intense. And of course, things are pretty bad right now. Now, I don't mean to say we don't have any ideas of things that can be helpful. There's a summary in your folder from our organization called Emerging Answers. It does list some programs where we have some reason to hope. And we can't wait for more research. Communities are making decisions every day about what to do, and it's important to offer them some ideas. For those of you who are students of this list, you may notice that our list, and actually most others, to date do not include any abstinence-only programs. We do not yet have any randomized trials of an abstinence-only programs that show effect, strong evidence of impact. That may occur at some point, we just don't have it yet. this area of sort of fighting over what works and what doesn't work has become sort of its own self-contained battleground in Washington and in policy circles, and we can talk more about that if you wish. But I know we're probably through the time slot, Matt, so let me stop right now.
Great. I hope we'll come back to that. So as the moderator, I'd like to take the prerogative of kicking off the discussion with a couple of elaborations, and then in a few minutes we'll open it up to questions from the floor. I also have received a set of email questions from people who have signed up for the audio cast. First, I wanted to turn to Saul, because this is a point you made but I think can't be made enough, about the efforts made in Kids Having Kids to really get at the causal issue, that so often we hear of the poor consequences of a teen pregnancy or a teen birth, and people think, well, this is not a young woman who is really in a good position anyway, so how do we know it is the birth or the pregnancy that is causal? And I think the value of this work is really its attempt to get at that.
Medical researchers have such an easy job. All they have to do is bring in subjects, they randomly assign them to different groups, they treat one, they don't treat the other, and all they have to do at the end of the day is measure. It's so easy. Now, we're not going to do that with teen births, right? We're never going to randomly assign people to have a teen birth and others not. If we did, we know the answer. But that sort of is a way to see where the issues lie. We know that the population having a teen birth comes to a teen birth not randomly, but with some sort of multiple disadvantages in their lives. They may be in tougher neighborhoods, less functional families, worse schools, all those kinds of things. So that's always the puzzle of social science, to try to distinguish what's correlational from what's causal. And the researchers in Kids Having Kids go to the ends of social science abilities to figure that out. It's never perfect, it's never final, the world is, you never hear the last word in social science. And that's why we can keep doing it and we can fight amongst ourselves. But there are many innovative ways in Kids Having Kids that try to parse that out. The one, even in my little summary, I talked about, suppose you have the same mother who has a child at 2 different ages. Now that's a very interesting thing, because now you're comparing children who grew up within the same family to the same mother, same father, we don't know, at different times. And that's a very interesting comparison, because you're holding some things constant in a way that you could never measure. Some of the work that's looked at the effects of a teen birth on the mothers has sort of controversially looked at the difference between young women who are pregnant, some of whom have a miscarriage and some do not. And in some ways, a miscarriage is kind of like a random event. It's not entirely, but close enough that you might think of that as a much better comparison. Each person in this article measures as well, in this book, measures as well as possible, and at the end of the day, takes an effect that is much larger when you just observe without controlling, and narrows it to one that they feel sort of confidently. This is the piece that if we could intervene and not change anything else, we could have these kind of benefits. Now, if we had a more comprehensive program and said, well, we can intervene in families and in schools and in neighborhoods, the effects would be much more like the broader effects, the true differences on average between teen mothers and mothers who have births at later ages.
Great, thanks for that elaboration. I want to go to one of the emailed questions now and turn to Sarah for it. It comes from David Crary of the Associated Press, and he writes, has there been anything useful to come out of all the publicity of the pregnancies of Jamie Lynn Spears and Bristol Palin? And Sarah's spent her summer not on vacation, but responding to questions like this. Or has the effect mostly been negative in conveying a distorted and perhaps glamorized impression of teen motherhood?
Well, Matt, you're absolutely right. I mean, there's been a long series now of events that popular culture and sort of real life has served up to all of us, that has allowed us to talk a lot to the press and sort of to the larger community. I mean, the way I think about it, it's been a 9-month odyssey that began with Juno and Knocked Up, and raced through the Gloucester teens who may or may not have had a pregnancy pact, all the way through to Jamie Lynn Spears, who was announced to be pregnant, then had a baby, and then accidentally didn't get married. And then we had the baby borrowers and the secret life of the American teen over the summer. And then what really just finally finished us all off is what we call Hurricane Palin, which was when, as your questioner is asking about the announcement of Bristol Palin being pregnant. It's been very challenging for those of us who are asked to respond, because what we want to use these as opportunities to talk about the larger issues and not be drawn into just a conversation about individuals. So I will often say, and I often did even about Bristol Palin, she's just one of 750,000 teenage girls who became pregnant last year. And in fact, her circumstances are atypical because she has great advantages and clearly family support and so on and so on. But I think Saul really is right. I don't think that we have all collectively used all of these events in an organized way to talk more systematically with American parents and community leaders and schools and families about this issue. We clearly as a society are still, despite all of these leads from popular culture, uncomfortable about really sitting down and saying we need to have many, many conversations in our family and in our communities about what we expect for families, for childbearing, and so forth. I'll just tell you one small anecdote. I often talk with parent groups, which I love to do because I myself have 3 daughters, and this has been an issue of interest for my whole life. And I'll sometimes just give little pieces of advice, like Aunt Sarah's advice. And I was talking the other day with a group, and I said, when was the last time we just said as a culture that babies need adult parents? Just babies need, and everybody wrote it down. And I thought, why are you writing this down? Why is this not, we're so busy arguing over abstinence or abortion or what everybody argues about that I think we have gotten away from some simple normative statements based both on research and on human experience about what is needed. So I guess the long answer, obviously long, is that we have lots of opportunities that are provided every few weeks to turn the conversation to these issues of, well, really, what are we saying to young people? What opportunities are we giving them? What motivation do they have to postpone childbearing? And we all need to use them, and I don't think we have enough.
Great. Final question, and then we'll open it up, which is, I think I'll direct toward Pat. I think primarily because of data issues, it's very difficult in kids having kids to talk about the fathers. But Pat deals with some of these fathers. We know there is a father involved in every teen pregnancy, and though much of our conversation today doesn't include them, I wondered if you could just say a few words about experience, research, how to think about the role of fathers in this issue.
Well, we do deal with the teen fathers, a small group because of staffing issues. But each year there is a small group of fathers who come to the meetings with the teen moms. These young men are not so much concerned about fatherhood as they are getting a job, or that's their major concern. It takes a while to work with them, and with these young fathers, and you have to stop and think that many of them are 15, 16. I've often heard the accusation that young fathers don't live up to their responsibility. But when you think of a 15-year-old guy who doesn't have a job, who's in high school, what is it we're expecting of him? And I think we as a society and country have to really think about what it is we're respecting of a 15-year-old father, and then help him do it. But we have another program that grew out of our work with the subsequent pregnancy mothers, sort of the other half of the equation. It's called Peer Advocates for Health, and we work with adolescent, primarily African American fathers on the south side of Chicago to train them to be peer advocates for male health. And when I started this program, people told me, I'd never worked with guys, I didn't know how to design a program for young males. People said, guys don't want to learn, guys don't want to come to group. The opposite is true. No one has ever given them any real information, and they're like sponges, and the more you give them, the more they want, and they're really enthusiastic about sharing it with the broader community. We've trained 160 peer advocates from 33 high schools, and they've talked to 6,000 other kids and distributed 30,000 condoms. So this is not a fatherhood issue per se, but we're trying to prevent fatherhood.
Great. So we'll now open it up to the floor. If you could raise your hand, we have a couple of Chapin Hall staff members with microphones, and please wait for the microphone, wait to be acknowledged. Then the third rule is identify yourself, just say who you are and what organization you're with, and then ask which panel member any questions. So let's begin up front here, I guess, with this gentleman.
Hi, I'm Kendall Marlowe with the Illinois Department of Children and Family Services. I'm wondering, we've got to just talk about the cost argument for a second. When we talk about the billions that this issue costs the public sector, the implication is that at least some of that money could be saved. And then when we talk about interventions, and we talk about interventions that show a measurable effect, the implication is then that those interventions might be able to save some of that money. Has any research been able to tie those two arguments together and say that this program reduced these public expenditures by an amount greater than the cost of the program itself?
Saul, do you want to take that?
That's a great question.
And then I'll go with
I think Sarah probably, you're asking for cost-benefit analysis, and that's exactly the right question to ask. Because it's an issue of how effective is the program, right? Well, here's the benefit, here's the cost that you can save, but
it's going to save more than it costs.
exactly. But is it going to affect 10%, 20%? Then we know how to scale those costs down. I'm not an expert on the intervention side. Sarah, yes? Take it.
Well, people have made those kinds of arguments. The problem from a policymaker's view is that the costs are not always realized in the same year, or maybe 6 months later in that same pot of money. In other words, if I make the expenditure from grant program X or whatever, can I literally show that that grant program now is enriched because of lower demand? And that really has not been shown. And often these costs are rolled out. Some of the costs that Saul calculates are calculated over many years. It's not a single year cost. So it's hard to do that. On the other hand, does Illinois have a Medicaid family planning waiver? I meant to look that up before I came here, and I apologize for that. But as you may know, one of the things that's required to expand Medicaid eligibility for family planning, this includes adolescents, requires a showing of cost savings within a year. And the 26 states that have Medicaid waivers have come up with a variety of ways of showing cost savings within a year. They're not quite as neat as what you're suggesting, but it does give some clues, at least in the sort of hurly-burly, not research-based Department of Economics cost, algorithms, that there are a number of people around the country who have found ways to make savings arguments, particularly for family planning dollars, which is related to your question. So it's not that it hasn't been tried, but it's been tried more in family planning and in particular programs.
Let me just jump in one second. The studies that have focused on intervention typically are looking at things like, does it delay initiation of first sex? Does it improve contraceptive use at last sex? So it doesn't quite articulate with what's being done in kids having kids, which is delaying a birth to age 20 or 21. That's an outcome that we just don't know about in a way. So we have these little teasers that shows beneficial effects, but we don't really have it expanded out to that time frame.
And I'm not sure any of those studies have dug into the cost of the program as much as necessary, because they haven't approached it from that cost-benefit perspective. Pat?
This is very program specific, but the cost of one participant in the subsequent pregnancy program is less than the medical cost of delivery for the second child.
That's one nice piece of the puzzle there that makes the case nicely. Okay, let's go over here to the back. Why don't we take, I'm looking at you right now. Yes, there.
Connie Dallas, University of Illinois at Chicago. And I'd like to thank the panel for a very informative presentation. And my question is for Dr. Hoffman. You painted a pretty bleak picture of teen motherhood. And while I appreciate the difficulty of social scientists in untangling all the factors, my concern is that by looking at age only, by focusing only on age, that you have lumped together the 14-year-old who is pregnant as a result of involuntary sex with the unmarried 15-year-old in Dr. Messina's program, with the 16 and 17-year-old in a long-term relationship with married 19-year-old moms. And I'm hoping you can untangle that a little bit.
Great question, and perfect. One of the ways in which the new kids having kids is new and improved is that it actually looks at two groups of teens separately. The first edition, for reasons that were peculiar to that study, looked at teens who were pregnant or who had births at age 17 or earlier, so these young teens. In the second edition, it looked separately at that group and then those who were pregnant at age 18 and 19. And it may not surprise you to find that all the negative effects, all the costs are really associated with that younger group, and the 18 to 19-year-olds have essentially no cost associated with them. That is, there's little to be gained. There's not much that's going to be gained by delaying births for that group. So when I'm giving you the cost story, it's almost exclusively those who are having births at age 17 and younger. The 14s, by the way, I mean, it's a sort of striking example, but it's 10,000 births annually. It's 10,000 too many, but it's 10,000 compared to about 420,000 in all.
Actually, let me follow up with an email question that came in, which I think relates to this, which is from Lee Smith in Florida. It says, in Frank Furstenberg's 2007 book, Destinies of the Disadvantaged, he makes a statement that teen childbearing has been misunderstood from the start. Do the panelists agree or disagree with Furstenberg's statement? What has been missing from our understanding of teen mothering, and what is needed to improve our understanding? So I think this relates a bit to this. I don't know, Sarah, do you want to say a word about that?
Well, Dr. Furstenberg has a very distinguished career in analyzing this area over many years. I think part of what he's reflecting back to us is something I mentioned a minute ago, which is there has been an inclination to almost overestimate this problem. I think he and some of his colleagues have said, look, it is important. I mean, Frank will admit that he would recommend somebody postpone childbearing until they're through their education and sort of all grown up and in a stable situation. But he, I think, has tried to say much of what we've said here, which is it's not just age, it's also circumstance, overall environment, and so forth. I think most of us feel that he's gone a little bit too far that way, but the point he's raised is well taken. Teen pregnancy and childbearing is not the worst thing that has ever happened to America. It's very important. We need to take it seriously. We need to do better. But we do have to understand that these prevailing issues of poverty, social environment, and so forth really are at the end of the day what really must concentrate our attention, not just age. And I think he's been very powerful in making people address that issue.
Saul, did you want to say a word on this?
Frank is a wonderful contributor to this general field. I mean, he almost invented it. I've published 2 articles with Frank. I admire his work. I think I don't agree with him, and I just don't think he reads. I don't think he reads the current research right. Yeah. Sarah's mostly right that sometimes he's responding to the people who are overreacting. It's not my favorite argument.
Pat.
I'd like to just throw out an idea, and again, based on very specific programmatic experience. But since we've been doing this program for so long, we're finding now that even at the same age, because I designed the program for 15 to 17-year-olds, and we have 12 and 13 and 14-year-olds now, but the difference in the same age kids 10 years ago and now, the kids we're serving now are much more needy with better contraceptive behavior. This is a hypothesis, my own, so better contraceptive behavior, the more together kids are not getting pregnant, and those that are now getting pregnant are much more needy. Their lives are more in disarray. Now, that's purely from our program, but I don't know if that's something, I've never heard anybody say that, but my home visitors across the state say it's much harder to serve the kids now than it was 10 years ago. In the same communities, the same age kids.
That relates to Sarah's statement about the changes in this field over 40 to 50 years. I don't know if you want to say a word, Sarah, to follow up on that?
Well, I think Saul even mentioned in the cost analysis that the sense is that it's more costly with the younger or the teens in the newer analysis than the older ones. I mean, I think when the campaign, my organization began in the mid-90s, and we were looking at this, we were worried from day one that even if the rates went down, what we'd be doing sort of be the easy wins. That we could, that there would be these young teens rather, men and women, who, if they were given just a little more support and a little more information, we could tip them over into delaying childbearing and so forth. But that there were serious social inequities and problems that would not be touched by, relatively simple things. I think we're sort of all saying the same. And there has been a lot of progress, but I think we remain confronting communities and neighborhoods and situations that are in very tough shape, and I think the economic downturn is going to make this only more severe, and I suspect that we're going to have to dig in harder, do more, and do many more intense interventions. I think maybe the easy wins, some of them have already been won.
Great. Let's go to this person right here by Claire.
Hi, Phyllis Handelman, Handelman Consulting. And one of my questions is, I have not been aware, and maybe those of you who are doing research know what is happening in this area, how much information on family planning is actually available and given to kids from middle school on up. I mean, and the reason I ask this question is a number of years ago, I did a study for the state of Illinois on why young women, low-income women, do not get early prenatal care, but show up in the later terms of their pregnancy. And one of the most significant responses was that they didn't know where to go for services. Even though clinics and hospitals were in their communities, they did not know that they, because they were teenagers, frequently could go there for help.
I love that question. As was said, I think a couple of times already this morning, we know that knowledge is not sufficient to affect contraceptive use or sexual behavior. But I'd say it slightly differently, friendly amendment. It is necessary, but not sufficient. If people really are lacking basic information about body parts, human functioning, where to go, what to do, how A relates to B, we have, I think, very limited hope of making progress in this area. And I hear an enormous amount about this, particularly in the context of the culture wars over abstinence education. We should teach this, we should teach that, people, I actually think that we are severely lacking in a detailed understanding of what young people know and the sources from which they get it. The national campaign, with Matt's leadership and help, is engaged right now in a nationally representative survey of what young adults know about sort of sex, contraception, and so forth. We actually, believe it or not, we don't even know what people 18 to 30 know, even though we have high levels of unintended pregnancy and abortion. And that is true also for adolescents. For all the arguing, for example, over sex education, we lack a nuanced understanding of not only what young people know, but even what's being taught. Because there can be a school policy in a given jurisdiction, but that doesn't tell you what, Mrs. O'Connell is teaching in her 2 weeks when the door is shut. And so even though, again, that knowledge is not the solution here, I think it's bedrock essential. And we really don't know, other than in an anecdotal way, what young people know and where they get their information and what is being provided in schools. And of course, the complexity mounts because of the internet. I mean, this argument has changed tremendously. People argue over what's going to be in XYZ classroom when the kids are in the back row on their cell phones downloading whatever information they want. So, yeah, well, it's true. So, the argument over classroom-based, what's on page 148 is trumped by Google. But so it's a much more complex picture, but we really do need more research is needed on adolescent knowledge, sources of information, classroom teaching, teacher training, and the list is very long.
Great. Other questions? Erin.
Yes, I'm his student. My name is Erin Berenger. I'm a student at the Harris School for Public Policy. And my question is for Saul again, sorry. I haven't read the book, but I'm looking forward to the second edition, and perhaps this is addressed. But in fertility studies, I know that there is a line that poor maternal health outcomes result from having kids too many, too soon, too early, too late. And I'm wondering if you can sort of break down your cost analysis a little bit about how much of the cost of adolescent pregnancy comes from poor maternal health outcomes, sort of future looking. And as a corollary to that, as we think about how we can approach teens and say, like, look, you don't want to have a kid this early for this reason, what kind of research has been done to approach the macro level to indicate, we know that teens that have pregnancies might also be at higher risk for STDs, which could result in lower health outcomes later on. How do we approach teens on a macro level and say, look, if you have a kid this early, these are the costs that you're really pulling out of your pocket to make to make this decision?
Well, we now have topics for the third edition of Kids Having Kids. Those are terrific questions, and they are not part of this book. That is, the maternal health impacts are not one of the things that was studied in the first edition or in this one. There is a chapter about health impacts on children, but nothing about maternal health. So it's not an issue that's come there. I don't know if there's other research that you would know about, Sarah, on that, but I do not.
I don't know about the research base, but I think this is absolutely going to the heart of the matter. Sort of the culture suggests to adolescents that they should postpone childbearing, or we say don't do it or whatever. But I don't think that most of the people who work in this field have really taken the time to explain and to have a conversation about why we feel that's our best advice. It's not intuitively apparent. I mean, if everybody in Hollywood and vice presidential candidates' daughters are getting pregnant, it is not apparent to an adolescent. If their mother was 15 when they had that child, why are you saying this to me? What is the reason? And it's a long conversation that touches certainly on maternal health. It touches on what we know from research is in the best interest of children. It touches, I think, a lot on what we know about what it takes to get a decent wage in this economy. I mean, Labor Department statistics now, I think, make quite clear that high school is not adequate. It's probably high school and 2, if not more, years of training for a person to have any reasonable hope of getting a toehold in this incredibly complex economy. How is a young person supposed to know that, just from the ether? So I think these issues of laying out the case, maternal health is absolutely one part of it, but there are many bases to be touched. I don't think, if you actually think about it, that we really do that. We sort of assume everybody understands why we recommend delayed childbearing later, not at 15. But I don't think we actually, in an organized, kind, conversational, warm way, work with young people over many years to make the case in terms that they understand that are personal to them. And if you don't know why you should, why would you do it? It's hard to use contraception. It's hard to avoid sexual activity. They both require enormous amounts of effort. The default position is sex with no contraception. So I think we should all challenge ourselves to say, well, what are the reasons? And then to figure out how that can be communicated and talked about with families and young people in our lives.
I want to get Bob into this conversation, not let him off the hook. The child abuse and neglect chapter seems to me to be at one end of the continuum of quality of parenting, but Are there ways that we could understand better, or do we understand better the quality of teen parents, or is that sort of deep end of those who actually abuse or neglect or lose their children to foster care really all we can know?
I think there's a lot more we can do. There is the issue around how teen parents get health care for their children. And that's often a reason why these children might come into care anyway, because of medical neglect issues. We've actually been doing some work with the department around the use of emergency rooms, the use of having primary care physicians, and the like. And you could extend that to families that aren't in the Department of Children and Family Services to see how health care is being provided by these kids. For low-income families, and less so for middle-class families. But the idea of generally how these young parents are getting care for their children in terms of health care. And the other one is child care. As I've been hearing the other panelists talk, 20 years ago, we didn't have a big call for preschool for all or highly developmentally focused child care. Now we do, and the question is why we need that. And the other question is, do good parents get their children into good preschools? And that's kind of a fact of urban life right now. Do bad parents not get their children into preschools, or why do we think they need preschool? So it's another question around good parenting and what we expect, and are we using childcare or pre-K to make up for some parenting flaws that people of all income levels might have.
Great. We have time for probably two more questions right here at the second table. And we'll bring you the microphone.
Marcia Nathan, COSUP DuPage County. And my question is also for Bob, and it kind of goes back to what the young before. On your handout, it seems to me like the percent of first placements for the 15 and under was quite low compared to, once they turn 16. Is that because more of those babies would be adopted by the under 15, or do the parents of the 15 and youngers take care of the children more? Is there any research on that?
There are just fewer. There are just fewer of those. That's why it's lower. This is really
true, but
as a whole.
It just seems like if they're under 15, they have the most education in front of them, that they would, enter the system. Or my interpretation would be they're caught sooner, their parents are more willing to help them, or am I just making false assumptions here?
It's a difference between the incident rate for 15-year-olds and the percent of the total that 15-year-olds represent. So it may be that if you are 15, your likelihood of having your child placed is higher than if you were 16. But the peak of teen births is more towards 16, 17. So you're going to see just a lot more of them and who enters care. Is that a true statement?
Right.
So I think your understanding may still be correct that 15-year-old on average faces many more challenges than a 16-year-old. But thankfully there are fewer of them getting into the situation. Other questions? How about all the way over on the right by the red curtain?
My name is Linda Casada from University of Illinois at Chicago, and thank you for your presentation. I'm not amazed, but I guess I continue to be somewhat distraught about the lack of attention to adolescent fathers, low income, because I think this conversation has 98% been centered on young women, and I understand they're easy to capture in research and study, etc., and they biologically have the children. But I think if you're really talking about this as a nationwide problem, and that we kind of say, yes, there's always a father, there's very little understanding of this father, only to say that he's more interested perhaps in getting a job. Yes, and if we understood what the families are putting him under, and he understands the reality that being a good father still means being a provider, we'd have a better understanding of family dynamics, of young fathers and their needs, because we're really disserving the other part of the equation very easily, and I think we're missing some big pieces in terms of really coming to some understanding. So, like I said, yes, easier to concentrate on the young girls, but boy, are we missing the whole business on young men.
It may be volume 3 needs to be boys having boys.
Okay.
But Sarah, let me turn to you first to give sort of the national picture on that, and then Pat to follow up.
Well, I completely agree with you. I've pondered this a lot. I mean, it's obvious why the focus is on females. You know, the girls are the ones who get pregnant. They're the ones who usually are left with child care responsibilities. And in truth, most of the contraceptive methods available are used by women. So, you know, I think we all understand why we tend to gravitate to that. But you're quite right. Sort of the men and teenage boys, and I underscore men, these are not all themselves adolescent boys, who father these pregnancies are largely absent from the conversation. And let me give you a very good example that's personal to me. As I mentioned a minute ago, we've done an enormous amount of press on all these things that have happened over the last year. I think except for Hurricane Palin, the incident that led to the most press were the 17 Gloucester, Massachusetts teens who may or may not have made a pact to get pregnant together and raise their children together. It turns out that probably wasn't true, although we've never really understood the facts. My count in our office is that we did 75 press interviews on that story alone over about a 2-week period. Not one reporter, no one. We had calls internationally, domestically, TV, radio, print. Not one reporter ever asked us about, did we know anything about the 17 boys and young men or whoever they were who were behind these 17 Gloucester, Massachusetts pregnancies. Not one. And I thought, that settles it. That, you know, if there's any doubt about the power of what you said, it was just brought home to me in, you know, neon lights. It is as though these things, there's sort of, you know, aerosol sperm or something, and these young women get pregnant and questions aren't asked. It is not a subject of major public conversation. I think everybody loses. The women lose, the men lose, the children in particular. So this is, I don't know if this is volume 3 or 4, but it is an essential and missing part of this story.
Well, I'm certain that's not the imagery we want to end with, so I'm going to turn to Pat.
Just want to make sure you're all awake.
I like the aerosol sperm. And I didn't mean to imply that employment was the only thing these young fathers were concerned about. It's not. But I was just saying, just meaning to imply that delaying pregnancy was not high on their agenda when when they get accolades for getting someone pregnant in many male social circles. And we do the imbalance between the access to information and the access to medical services between female teens and male teens in this country is way greater than it should be. If you look at the data from use of medical services between teen girls and teen boys, after they leave their pediatrician service, then the guys just don't get services, especially in the low-income neighborhoods. Their medical service is the emergency room. And we're not giving them information. The information they get is off the street. As I say, with our peer advocates, they're like sponges. No one else is giving them real facts. And we start with what's the real name for the body part, because they don't get it in school. They don't get it from their parents. There's a major void in terms of getting information and access to services. We've had our peer advocates take other young men to clinics, standing there and not been served because they didn't have a medical card or they didn't have their mother. Well, if the guy's going to get checked out for STDs, he's not going to have his mother there. So the access to services is a major issue for young men.
Thank you. I think given the hour, we're going to have to bring the formal part of the program to a close. And I want to thank our panelists who came from near and far to have a very interesting conversation, and you, our audience, both on the phone and in person. It's been a very valuable morning, and we look forward to further conversation and possibly further research.